Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Pancreatitis and its vascular complications. So this includes there is a arterial as well as the vascular. Now let's look at the arterial. So this is the arterial pseudoaneurysm. Pseudoaneurysm. So in terms of the arterial pseudoaneurysm, it is caused by the damage to the vessel wall. So there is damage to the vessel wall, and this is by the pancreatic elastase. So this is totally by the pancreatic elastase. And next is the most common vessel affected. So the most common vessel, if you see what is affected, it is going to be the splenic artery. It is a splenic artery, but the SMA means the superior mesenteric artery, and the cystic artery, superior mesenteric artery, the cystic artery, and the gastroduodenal artery, GDA, they may be affected. So they may be affected. Then there may be the spontaneous rupture, which results. There is a spontaneous rupture. So the spontaneous rupture, it results in the massive bleeding. So it can result in massive bleed. Then the clinical manifestations, it includes the sudden onset of abdominal pain. So sudden onset of the abdominal pain, and there may be tachycardia as well as presence of the hypotension. Next is there is CT angiography. CT angiography. So CT angiography, it is the investigation of choice. Now let's look at the treatment. The treatment, it includes the arterial embolization. There is arterial embolization, as well as there may be ligation of affected vessels. There is ligation of the affected vessels, and this is in refractory cases. Next, we look at the vascular thrombosis. So in vascular thrombosis, the vessel it's usually affected is the splenic vein. The vessel affected is the splenic vein. But in severe cases, it can extend up to the portal venous system. So it can extend up to the portal venous system. So the clinical features, it includes the splenomegaly, as well as the gastric varices. Next is the splenic vein occlusions. So there can also be the splenic vein occlusions. Next, we move on to the treatment. So the treatment, if you see, it is mostly conservative, and it also includes the thrombolytics. There is thrombolytics, and this is seen in terms of the acute early phase. To learn and grow daily like this, please do subscribe.